One of the things the government is rolling out its budget, and it's running into implementation bumps. So, for example, in public health, a lot of pushback. Because public health is actually co-funded by local municipalities through mill rate assessments. So when we make changes to the public health system, it really is a partnership approach.
It is. And we are actually taking that approach. There's been some misinformation that has been given out by the media. We are looking at changes to our budget for 2020, and we have made that announcement. We let the public health boards know that we'll be looking at making changes to how public health is administered, but not how it is being delivered. And when we let them know that as part of the budget process, a number of the public health boards, my expression is, why react when you can use the same energy to overreact? And that's the case right now in a lot of places. We have started a consultation process. It's not completed yet. We've just started that consultation. What we know is that the administrative and bureaucratic side of how we deliver it is costing a higher percentage than it should be. So we need to make some changes to it so that more of that money goes down to the frontline services.
What is that ratio that we're changing? Because we're going from some percentage to a lower percentage? Is somebody quoting that number? How do you say you're spending too much on administration and public health?
There's a dollar value that has been associated to public health, and when we look at how much is being delivered and how much is being spent on bureaucracy, although the budget has increased, the amount of money that's being spent on the administrative side has increased, and the amount of money that has increased or been spent on delivery side has not increased at the same rate.
Okay. One of the challenges too is the local medical officer of health is a physician. They're not just a manager, but they actually bring clinical content to outbreak management at nursing homes, or C difficile at hospital, or immunization rates in public systems, or public policy as it relates to building permits and septic systems and restaurants inspections and things like that. I'm assuming then that you've got, as you reduce this administrative layer, the technical content that some of those folks did is being accommodated in your new model?
Absolutely it is. Right now we have 35 medical officers of health across the province, and then we have some associate medical officers of health. Do we need to have 35 people at the top of the chain? Can we have 10 and increase the number of associate medical officers of health who are dealing strictly with the medical side of it and not the administrative side? Can we reduce then the number of hours that are spent on administration by those medical officers of health and increase the number of hours that are being spent on actual health for them?
Because we're seeing superbugs, we're seeing declining immunization rates, we're seeing the measles outbreak, and I guess we had one of our first cases in Niagara Falls, Markham. We're seeing life on the streets, perhaps bringing back a resurgency of tuberculosis.
Yes.
So there's a lot of things that we have done public health-wise in the past. They're kind of on the cusp of a resurgence.
Yes, and how do we stop that? Because the current system that we're using right now is not preventing it. If we continue down the same path that we are right now, then things will get worse. Let's take a step back, review what we're doing, find a better way of doing it, and make sure that what the money that we're putting into it is actually going into the prevention side of it, and it's not being used on an administrative side.
Yeah, again, you can't read the paper or watch the news about the opioid crisis and a whole bunch of things that have sort of been out of sight, out of mind, but man, they're on the cusp of really exacting a toll on society. The local Board of Education also concerned about how they will phase in some of these cuts, the provincial funding. They're in a window of uncertainty. We're into the second month of the fiscal year.
Yes.
They too have a mill rate assessment or a tax-based revenue stream. Any advice or counsel to that side of the equation?
It's really interesting how this has been rolled out, because if you take a look at the school boards themselves, the school boards have not been very vocal with any opposition to it. The opposition has come primarily from the Ontario Secondary School Teachers Federation. And what we're looking at then is, again, where is the money being spent? How is it being spent? And how do we do it in a way that is more effective? Ultimately, we had 2.2 million students in Ontario in 2004, and we had 112,000, almost 113,000 teachers. Today, we have 109,000 less students at 2.1 million, and we have 126,000 teachers. and yet our math scores are lower, and yet we're not doing as much in STEM. We have students who are going off to college and university and not being as successful. So is the system, the way it is structured, working? And I would have to say that the answer is no.
Okay.
So we need to make a change to that.
Yeah. And part of that statistics was also when you eliminated grade 13 and went to grade 12. I mean, that was a big change that we're still kind of watching the ripple of that. As
Sure, but that was more than 30 years ago now.
Yeah, so it's, well, it takes a generation or two to kind of make this thing happen.